Treatment of Bell's palsy hinges on the early intervention with corticosteroids, and these are used to reduce the inflammation. Multiple randomized control trials and meta-analyses confirm the corticosteroid therapy. If it's initiated within the first 72 hours of the symptom onset, it increases the likelihood and the speed and recovery of the facial muscle. It's usually a 10-day course of corticosteroids such as prednisone. Antiviral medication is sometimes added to the corticosteroid regime in severe cases, but studies have been inconclusive as to whether the antivirals offer any significant benefits. The impaired tearing that accompanies Bell's palsy can put the eye at risk of damage. The cornea can become dry and scratched, and this can lead to permanent vision problems. It's recommended while awake, patients use artificial tears 4 times a day, or every hour if needed, and apply ophthalmic ointments at night. Eye patches or protective glasses can also help. Targeted exercises can help in the case of residual muscle weakness or dysfunction, and specialized eyelid surgery, such as customized weighted implants and horizontal lid tightening, might be indicated in cases of persistent inability to fully close the eyelid. Low-level laser therapy, also known as cold laser, utilizes wavelengths of light between 600 nanometers and 905 nanometers, whereas high-level laser therapy generates heat and can be used to cut or destroy tissue, such as growths or tumors. The low-level laser therapy stimulates the tissue repair, reduces inflammation, and relieves pain without generating heat. In Bell's palsy, low-level laser therapy is believed to enhance the healing and the regeneration of the nerves by increasing blood flow to the affected tissues and decreasing the inflammation. In a randomized control trial in 48 subjects who were being treated for Bell's palsy with facial massage and exercise, the addition of a low-level laser therapy was more effective than facial massage and exercise. Another randomized control trial in 46 Bell's palsy patients found the low-level laser therapy in conjunction with facial exercises led to a greater improvement after both 3 and 6 weeks than the facial exercise alone. In an uncontrolled study, 11 of the 14 Bell's palsy patients experienced complete or significant recovery after 12 sessions of low laser therapy. Another uncontrolled trial found the low-level laser therapy resulted in a complete recovery in 18 and a partial recovery in 6 out of 30 Bell's palsy patients with poorly controlled type 2 diabetes who were not being treated with corticosteroids. In a case report, a 3-year-old child with Bell's palsy recovered facial muscle function after 3 weeks of treatment with low-level laser therapy, consisting of 11 sessions lasting 15 to 20 minutes each. A positive response to the 3 sessions of the low-level laser therapy was reported in the case of a 13-year-old child with Bell's palsy and in a 71-year-old Bell's palsy patient. The recovery was remarkable after 5 sessions and complete after 10 sessions. 2 long-term effects of Bell's palsy are facial asymmetry and a condition called psychonesis, in which voluntary facial movements result in the involuntary movement of a different facial muscle group. A case study examined the effects of injections of facial fillers like hyaluronic acid gel and the botulinum toxin or Botox for the treatment of a 50-year-old woman with these complications. Multiple rounds of these treatments improved the facial asymmetry and the muscle spasms, reducing the pain and improving her quality of life. The Botox can also be administered to the non-affected side of the face to improve the facial symmetry and the cosmetic appearance in people with Bell's palsy. Hyperbaric oxygen therapy involves sitting in a pressurized chamber and breathing 100% oxygen for approximately an hour. These treatments increase the amount of oxygen in the blood, and this can help to increase the oxygen delivery to the facial nerve, and thus it's been suggested to help speed up the recovery of Bell's palsy. Although there's a scarcity of well-designed, randomized control trials that examine the effects of hyperbaric oxygen, one study did compare the effects of the hyperbaric oxygen to corticosteroids for people with Bell's palsy. The study used 1-hour sessions in the hyperbaric oxygen chamber, twice a day, 5 days a week, for up to 3 weeks, or until total recovery, along with comparing it to a placebo. The treatment regime was compared with normal atmospheric oxygen and with 450 milligrams of prednisone delivered over 8 days. After 9 months, more than 95% of the people who received the hyperbaric oxygen therapy had a full recovery, compared with less than 76% of those who were receiving the prednisone. Furthermore, the hyperbaric oxygen treated group showed significant improvements in nerve excitability measures compared with the prednisone treated group. On the basis of these preliminary findings, the hyperbaric oxygen therapy might represent a potential treatment for the Bell's palsy. Infusion therapy is an approach for treating Bell's palsy, and it uses corticosteroids mixed in an infusion solution containing dextran and pentafloxacin. The corticosteroid reduces the inflammation, and the combination increases the blood flow to the nerves. Although this approach has not been heavily researched in recent years, multiple older studies in Europe and Asia have found it to be effective for treating the Bell's palsy and suggest it may be more effective than the steroids alone. One study compared the effectiveness of a 7-day infusion therapy against the orally administered steroid. The patients with complete paralysis who received the infusion therapy had a significantly better recovery rate when compared to the steroid group. Another study by the same investigators modified the infusion therapy, and it was found that 87% of the patients with complete palsy had a total recovery when treated with a modified infusion therapy, compared to only 68% who just received the oral steroids. Nerve growth factor is a protein with neurotropic effects. Like all neurotropic factors, it's involved in regulating the growth, maintenance, and survival of neurons. Nerve growth factor was the first neurotropic factor to be discovered, and it's widely used in China to promote nerve repair and regeneration in a range of neurological conditions, like Bell's palsy. A meta-analysis of 8 clinical trials performed in China found the inclusion of nerve growth factor in the Bell's palsy treatment was likely to improve the outcome. In the clinical trials, nerve growth factor was administered via intramuscular injections in doses of 30 micrograms per day for 7 days, or 4 micrograms per day for 7 to 28 days. Although the analysis of the findings suggested favorable effects of the nerve growth factor, the researchers were unable to draw a firm conclusion due to the low quality of the evidence. Since Bell's palsy might be linked to the reactivation of the herpes simplex virus, dietary strategies that inhibit the virus may also prove to be effective for treating or shortening the duration of the Bell's palsy. Arginine is an amino acid, and it appears to be particularly important for the replication of the herpes simplex virus. Multiple studies have found depriving the herpes simplex virus of arginine halts its replication. On the other hand, the amino acid lysine impairs the virus's ability to use the arginine, thereby slowing the viral replication. So avoid foods such as peanuts, tree nuts, and chocolate, which are high in arginine and low in lysine, and this may suppress the herpes virus. Multiple studies have found that acupuncture can improve the symptoms and return the normal facial function in people with Bell's palsy. A meta-analysis that included 11 randomized control trials with a combined total of 1,258 participants found acupuncture increased the likelihood of cure, and it may be more effective than medications for treating Bell's palsy. A previous meta-analysis of 14 trials with 1,541 participants similarly found acupuncture may enhance the recovery in Bell's palsy patients. However, methodological differences in the clinical trials have made it impossible to say for certain whether the acupuncture is an effective therapy for this condition. MRI studies show Bell's palsy is associated with the abnormal functional network in the brain, and this is normalized through successful acupuncture treatment. Electro Acupuncture, a technique which uses a low-level electrical current that's passed between two acupuncture needles, might lead to improved outcome over typical manual acupuncture. Factors such as being younger, normal weight, being in the acute stage of the condition, and with less severe symptoms have been shown to increase the likelihood of benefiting from acupuncture. Biofeedback can help people who've incomplete recovery from Bell's palsy to learn to control the facial muscles by responding to the reinforcement cues. Biofeedback strategies that use mirrors and measurements of muscle activation to reinforce the muscle control have been shown to improve the facial symmetry and to reduce the abnormal muscle movements in the patients with long-term consequences from Bell's palsy. One study reported on the effects of mirror biofeedback training combined with Botox therapy in 27 cases of facial psychonesis following the facial palsy. Improvement was noted at each of the 4 evaluations, and lasting improvement was attributed to the biofeedback portion of the treatment. Another study with 22 participants found mirror biofeedback enhanced the effectiveness of standard physical rehabilitation. Other biofeedback techniques involving taping of the facial regions to build sensory awareness have also been reported to improve the facial muscle control. Physical therapy may help people with Bell's palsy to recover the muscle function, while facial exercises can help to improve the muscle function and reduce the involuntary movements in the people with Bell's palsy. The overall evidence of benefit is sparse. Physical rehabilitation, consisting of stretching and manual and verbal input, applied at an early stage, resulted in an overall improvement of the condition of the Bell's palsy, and it accelerated the recovery compared with non-rehabilitated patients. The overall usefulness of the physical rehabilitation therapy is still uncertain. Nutrients that promote neuronal health, quell inflammation, and inhibit viral activity might confer benefits by targeting the mechanisms that underlie Bell's palsy. Other nutrient interventions that might be beneficial are described in my inflammation video and my herpes video. Vitamin B12 is important for neuronal health. In a control trial that compared 3 treatment regimes for 60 subjects with Bell's palsy for more than 2 weeks duration, the first group received 500 micrograms intramuscular injection of methylcobalamin 3 times weekly for at least 8 weeks or until recovery. The second received 60 milligrams of prednisone daily that was tapered over 3 weeks. The third received the methylcobalamin B12 plus the prednisone. After 1 week of treatment, the methylcobalamin and the methylcobalamin plus the prednisone group improved significantly, but the prednisone alone group showed only a slight improvement. It took on average about 2 weeks for the participants in the B12 and the B12 plus prednisone group to achieve a complete recovery versus 9.5 weeks in the prednisone only group. A meta-analysis that included 5 randomized controlled trials with a total of 344 Bell's palsy patients found B12 injections along with acupuncture reduced the likelihood of incomplete recovery compared with acupuncture alone. Because B12 is generally safe and relatively inexpensive, it represents an intriguing natural option for treating Bell's palsy. Acetylene Carnitine is a compound and it's found throughout both the central and peripheral nervous system, and it plays a role in several processes, including the processing of fatty acids. A randomized placebo-controlled trial in 43 subjects with idiopathic facial palsy found those who were given 3 grams of oral acetylene carnitine along with 50 milligrams of methylprednisone every day for 2 weeks had a more rapid functional recovery of the facial nerve when compared to those who were given the methylprednisone plus the placebo. After 10 days of treatment, a measure of paralysis was reduced by half in the acetyl L-carnitine group, but it was unchanged in the placebo group. Additionally, supporting the use of acetyl L-carnitine are studies with the nutrient in other conditions involving nerve damage. Preclinical research showed the acetyl L-carnitine prevented and mitigated the nerve pain that was caused by the chemotherapy drug paclitaxel. 2 clinical studies found acetyl L-carnitine to be effective for treating the various forms of neuropathy, including diabetic and drug-induced neuropathies. Given the relatively benign nature of Bell's palsy, its typical limited disease course, and good prognosis in most cases, few human clinical trials have examined nutritional interventions. Nonetheless, owing to the inflammation and the nerve involvement in the Bell's palsy, several nutrients that promote neuronal health and mitigate inflammation may be helpful. Niacin, or vitamin B3, is a vitamin that can cause blood vessels to dilate, and this is why it causes flushing in many people. This increased blood flow has been proposed to help to speed up the healing of the facial nerve. Some evidence suggests the niacin, when administered orally or via intramuscular injections, might be useful for treating the Bell's palsy. In an older series of 74 cases who were treated with 100 to 250 milligrams of niacin, all but one case resulted in good facial nerve response within 2 to 4 weeks, such that an observer would be unable to point out which side of the face had been paralyzed. Omega-3 fatty acids can reduce inflammation in the body. The omega fatty acids commonly obtained from fish oil, DHA and EPA, inhibit the signaling of a pro-inflammatory molecule called nuclear factor kappa B, and it reduces levels of other chemicals that trigger inflammation, such as tumor necrosis factor alpha and interleukin-6. These fatty acids are also metabolized into compounds called resolvins, and these protect nerves from inflammatory damage. Some preclinical evidence suggests the omega-3 fatty acids can help to improve the recovery after nerve damage, while in healthy people they've been shown to improve the motor nerve function. In type 1 diabetics, fish oil supplements have also been shown to significantly improve the nerve growth. Numerous studies indicate ginkgo biloba has neuroprotective effects, and this can make it useful as a therapy for Bell's palsy. For example, ginkgo has been found to inhibit free radical damage to nerve cell membranes, to reduce neuroinflammation, improve neuronal mitochondrial function and energy production, and promote nerve growth and formation of neuronal connections. In preclinical studies, ginkgo extracts have been found to enhance nerve healing after injury related to trauma, toxin exposure, ischemia, and oxidative stress. An active component from ginkgo was found to promote the regeneration of myelin, in part by reducing the inflammatory signaling in animal and cellular models of a demyelinating disorder. A compound from ginkgo has also been demonstrated to have antiviral activity against herpes viruses in the lab. Curcumin is a carotenoid and is found in turmeric. It has potent anti-inflammatory properties, and it's been shown to help protect against nerve damage that was caused by diabetes and alcohol, possibly by protecting the neurons from the inflammation-induced damage. Specifically, curcumin is able to reduce the inflammation by increasing the activity of proteins that inhibit the activity of NF-kappa B, which is a major trigger for inflammation. Curcumin has also been shown to protect the neurons from damage in preclinical models of stroke, Alzheimer's disease, and oxidative stress. Green tea contains high amounts of polyphenols that are known as catechins, including epigallocatechin gallate, or EGCG, and this scavenges free radicals. It inhibits oxidative injury, and it lowers oxidative stress levels. Preclinical research indicates the EGCG might specifically protect the neurons by suppressing inflammatory signaling by the activated immune cells in the nervous system, and by promoting the release of an important nerve growth factor called brain-derived neurotrophic factor, or BDNF. Animal research suggests the EGCG might also reduce the body-wide and nervous system inflammation that's related to metabolic disorders, which increases the risk of Bell's palsy. Animal models show the EGCG may play a role in preventing a range of neurological disorders. Vitamin E is comprised of tocopherols and tocotrienols, and it has free radical scavenging and anti-inflammatory effects. It has particular neuroprotective effects because of its nature as a lipid compound, and it's been studied to be beneficial in a range of neurological disorders. Studies in animals have shown the vitamin E has the potential to protect against oxidative and inflammation-related nerve damage. Other animal research indicates adequate vitamin E is needed for an effective immune response to the herpes virus. Alpha-lipoic acid, a free radical scavenging nutrient involved in glucose and fat metabolism, is used to treat metabolic disorders like obesity and diabetes, as well as neurological complications like diabetic neuropathy, dry eyes, and retinopathy. Alpha-lipoic acid has been shown to improve nerve function in animal and lab models of neurological dysfunction, as well as in some clinical research. Licorice has been used traditionally to combat viral infections. It contains compounds that exert strong anti-inflammatory effects, and it's been demonstrated to have antiviral activity against several viruses, including the herpes simplex virus 1 and varicella zoster virus in preclinical studies. Zinc is an important nutrient for normal nerve function, and a deficiency can cause hearing and taste disturbances and can contribute to depression and neurological disorders. Zinc supports the nerve growth and the formation of new neuronal connections. It also inhibits the replication of the herpes virus, and it's been effectively used in multiple clinical trials to reduce the duration of herpes outbreaks. Lysine is an amino acid, and it's sometimes used to treat the herpes infections. A double-blind, placebo-controlled trial included participants with oral, facial, or genital herpes, and they found 1 gram of lysine 3 times a day for 6 months reduced the frequency, duration, and the severity of the herpes outbreaks. Findings from other studies suggest the lysine supplementation, particularly at doses higher than 3 grams per day, can reduce the frequency, shorten the duration, and decrease the severity of cold sores due to the herpes virus. The Rishi mushroom has been used medicinally for centuries in China, Japan, and Korea. Researchers have identified 2 different compounds in the Rishi mushroom, known as GLPG and APBP, and these have shown strong antiviral activity against both herpes virus 1 and 2 in lab settings. The Rishi compounds have also been shown to reduce inflammation, lower oxidative stress, and strengthen the immune defenses. Herbal preparations containing Rishi mushroom have shown promising results in uncontrolled clinical trials in subjects with herpes virus outbreaks. A combination of 6 medicinal herbs, including Rishi, was reported to reduce pain that was caused by shingles in 5 cases. Other trials reported the same Rishi containing herbal mixture reduced pain, and it shortened the symptom duration in patients with recurrent oral and genital herpes outbreaks. Lemon balm is a plant in the mint family, and it's used traditionally to treat herpes outbreaks and other viral infections. Multiple lab experiments have shown lemon balm extracts possess antiviral activity against both herpes simplex virus 1 and 2. Clinical trials have evaluated the efficacy of topical lemon balm preparation and has shown positive results. In a double-blind, placebo-controlled trial with 66 participants, a lemon balm ointment applied 4 times a day for 5 days improved the symptoms of oral herpes, shortened the healing time, and prevented the spread of the infection. The authors further suggested the lemon balm might increase the time between the outbreaks. Lemon balm has been noted to protect nerves from injury due to inflammation, hypoxia, and oxidative stress in lab and animal models. Propolis is a resin-like substance, and it's obtained from beehives and has a long history of medicinal use. It contains a mixture of several compounds, including flavonoids and other polyphenols, and these have strong anti-inflammatory and oxidative stress reducing effects. Some propolis-derived compounds have demonstrated antimicrobial activity, including antiviral activity against herpes simplex virus 1 and 2. Comprehensive reviews suggest the propolis might be beneficial for treating herpes virus-related skin lesions, but available research is not high quality. In clinical trials in subjects with herpes lesions on the lips, a 0.5% topical propolis extract was more effective than topical use of the anti-cancer drug Aclovir for shortening the time to healing and for reducing the symptoms such as pain, burning, itching, tension, and swelling. Fusidins are naturally occurring polysaccharides, and they're found in edible brown algae, and they've been found to promote balanced immune function in preclinical models. They also strengthen the antiviral immune response, and they demonstrate direct antiviral action, including against herpes simplex virus 1 and 2 in preclinical research. Additionally, the fusidins have the capacity to reduce inflammation and oxidative stress. A report on 2 case studies noted the use of a topical 4% fusidin cream markedly decreased the healing time that was associated with recurrent oral herpes outbreaks. Several other nutrients with anti-inflammatory, antiviral, and neuroprotective properties might play a role in speeding up the healing and the recovery in patients with Bell's palsy. These include vitamin A, C, and D, flavonoids such as resveratrol and quercetin, as well as flavonoid-rich elderberry extract, also have these properties, and they have the potential to help to promote the Bell's palsy recovery. Probiotics may modulate the immune function and also support neuronal health and regeneration. For more on herbs, supplements, and natural treatment plans, check out my website.